my name is Heather Cole. I'm a physical therapist assistant with Orthopedic and Spine Center Physical Therapy Center in Newport News, Virginia, and I'm here today to talk to you a little bit about scar massage after a joint replacement. After your joint replacement and they cut through your skin, you build up a collagen-filled scar tissue that can, in turn, as it forms, limit your range of motion and your function. As that tissue forms, it's not nice organized tissue like what you would normally see with your skin and your fascia. It's disorganized, thick, bunched up tissue that needs to be released in order to allow full range of motion. When we look at your knee after a surgery, we want to make sure that it heals very well before we start working on the scar. You want to make sure there are no scabs available, no open areas to possibly open and give areas for infection when we're working right around the incision. All steri strips should have been removed, staples should have been removed, and it should be a nice, well-healed scar at this point. The benefit of scar massage is to allow the tissue to become more organized and to allow full range of motion. When you have disorganized tissue that's crossed like this, and you go to stretch that tissue, it doesn't stretch in a linear pattern like it should. And especially with the knee and hip, it needs to be able to stretch in that linear pattern. So what we want to do is go in and use our hands to break up some of that scar tissue, which doesn't happen overnight, but with repetitive treatments, it can loosen that up, reorganize that tissue, and improve your range of motion. So when we're looking at a scar, please excuse my crude rendering of a scar here, we want to look in two directions. We want to look at a vertical mobility and a horizontal mobility. It's important that we address both because, again, that tissue is very unorganized. So we'll start at the top of the scar, thumbs indenting into the skin just slightly but not pulling apart. And you want to move your thumbs in opposite directions in order to actually move the tissue. Now it's important that you don't use lotions or creams or oils with this type of massage because we want the friction of the skin to be able to separate so that we're actually moving the scar tissue and not just gliding over the skin. So you'll work your way down and you'll notice, especially after a joint replacement, the further down the leg you go, the more restriction you will have. And the reason that happens is because when you start to bend your knee, the tissue starts to stretch closer to your body first. So when your range of motion is limited in the beginning, this area down here never gets stretched. So it stays very constricted and can actually prevent your range of motion at a later date. So always start at the top and kind of get used to it. You're going to notice that it's probably a little sore and a little sensitive. You may even get numbness or tingling with it when you start because the nerves aren't fully healed yet from the surgery. You want to take a minute or two in each direction. So we're going to kind of work up and down, and you want to definitely work more where the restriction is. So if you start here and you get nice glide like my model is showing here, you're probably okay there. We'll come down here and you may see a little more restriction where you're getting more movement like this. That's where you want to work. Once you've done your vertical pass, you want to come, and you can start at the top or the bottom for this one, and we're going to go horizontally across the scar. Now this is why we really want that scar to be very healed when we're working on this. We don't want anything to open up, we want it to stay nice and closed. So it needs to be at a very good healing point patient, anywhere from 4 to 6 weeks depending on the patient. Now if at any time you see anything that's opening up a little bit or any fluid discharge or anything like that, you want to stop and consult with your physician or your therapist before you continue this intervention. And you'll just use that cross friction across the scar to loosen that up. And so as that scar tissue loosens and starts to form a more linear pattern, the skin, the fascia, and the muscle will all glide more easily over each other and separately from each other so that your range of motion can improve. All right? Following your joint replacement physical therapy is a great adjunct to help you heal. Please talk to your therapist about scar massage and how it could benefit you. Thanks for watching.